My name is Dr. Bill Farrell. I'm an orthopedic surgeon at Midwest Medical Center. I grew up in southwest suburban Chicago and went to college in Cleveland, came back to Loyola Medical School, and then did my orthopedic training in northwest Pennsylvania. I then came back in 1985 and joined a private practice orthopedic group and was with that group until March of 2020. I started at Midwest Medical Center in June of 2020 and have been working here since that time. I grew up in a family of healthcare. My two brothers are physicians. My father was a pediatrician, and everyone in the family, my sisters as well as my mother, were involved in healthcare in one fashion or another. So it was almost second nature and a perfect fit. What really attracted me to the profession was the gratitude that patients would talk about the care that they received on behalf of my father and some of his colleagues. And so that was very meaningful, and it was an opportunity to give back to the community. I provide general orthopedics, both upper and lower extremity orthopedic care. My interest is primarily lower limb procedures such as knee and hip replacements, as well as knee arthroscopy, and also non-complicated fracture care or traumatic care, if you will. Recently, the institution purchased a hip fracture table so that we can provide that service to the community. So again, they don't have to out-migrate, and I'm excited about that and willing to provide that service to the community. I like sports of all types. I golf, and I don't have any one particular hobby. I sort of dabble in a lot of different things. I do like volunteering and helping at my church. Try to find some alternative off-work options that will be meaningful in the big picture of life. I chose the medical center because it frankly fell in my lap. My brother's an internist on staff here, and there was an opportunity to provide orthopedic care in the community so that the local population would not have to out-migrate to receive care for common diseases in the orthopedic arena, such as knee arthroscopy and joint replacement, and even fracture care at that. I have been most pleased since I started. The staff here is second to none, and I can say that with true sincerity because I worked at several institutions and can comment on that. I think we have a wonderful team. I always talk about a team because it's not just me, it's everybody, from maintenance to food service to physical therapy to nursing assistants to administration, to all in providing excellent provider care. Furthermore, my experience thus far, although it's not quite 1 year, has strengthened the willingness to continue to want to work here because I get good feedback from the patients about their experiences when they're not only an inpatient, but also the outpatient clinic as well. This is a wonderful place to provide medical care, and I think the community needs to be aware of it if they are not.